Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and I'm a PT assistant. Today, I am interviewing Rick Olderman, physical therapist and author of the Fixing You book series. Today, Rick and I are going to be talking about sciatica, some common causes, and a couple exercises you may want to try. If you want to listen to the full podcast, check the description box below. Well, welcome back to the program, Rick.
Thank you. Happy to be here.
So our first topic of discussion is sciatica. So can you explain what sciatica is and possibly give us 2 exercises you would recommend for it?
Oh, sure. I'd love to. So sciatica is basically a nerve or radicular pain that runs down, usually the back of the leg, and go all the way to the foot. Sometimes it goes just to the butt, and it just feels like this nagging chronic pain. And the sciatic nerve is comprised of nerve roots that exit the lower lumbar vertebra and the sacral area. And they all these roots come together to form one sciatic nerve that passes through the back of the hip and then basically branches off as it goes down the leg to supply all the muscles down there. So there are usually 2 things that are causing sciatic pain, and they can happen both at the same time too. So one of them is what I call an extension problem, which means that there's too much arch in the back. And it's not so much that there's too much arch in the back, it's that there are too many forces trying to pull the back into that arch. So you can test this in yourself first. If you just lie down with your legs straight for 30 seconds and then bend your knees for 30 seconds. If your back feels better when your knees are bent, it means that you have too much arch in your back or too many forces trying to pull your back into an arch. So the first exercise I'm going to give you for sciatica is that one of the major stressors creating that excessive arching in the back is actually coming from the thigh muscles in the front. So we have really huge thigh muscles, and they start down here at the knee and they attach into the pelvic bone right here. Right now I'm pointing to the front of the skeleton. And so when those muscles get tight, they tend to tilt that pelvis forward. Or if the pelvis doesn't actually move, it's a force trying to tilt the pelvis forward. And then that is felt in the vertebra back here. And arching of the spine increases compression in the spine. So usually this is one of my big deals is for sciatica is to stretch these guys out. And usually the side of the leg that you're feeling the sciatica in, that side's thigh muscles will be tighter than the other side. And so you'll want to spend a little bit more time stretching that sciatic pain side rather than the other side. And I have this stretch in my book. I also have it in my home programs. But basically, what you're going to do is you're going to lie on a table like this. You're going to bring both knees up to your chest. You're going to hold on to one knee with your hands, and then you're going to lower the other leg over the edge of the table. And this knee up here is stabilizing your back so it doesn't go into an arch. So you want to be sure that you're holding that really securely. All right. And then the other leg is basically when it's dropping down like this over the edge of the table, it's stretching all of that thigh muscle out. This is the safest way I find to stretch the thigh muscle because it's the best way to control the back and the pelvis while you're trying to stretch those thigh muscles. The second exercise or the second pattern that's causing sciatic pain is something I call a side bending problem. And that means that the pelvis is sitting higher on one side and the rib cage is sitting lower. And as you can imagine, that's going to create more compression here on this side of the spine. And you can see this in yourself if you take your shirt off and have someone take a picture of your back. Usually a person who has an older side bending problem will have a bigger crease on that side bending side than the other side. All right. So why does this happen? It's usually because of some older injury in the leg, in the same side of the pelvis that's higher. That leg will have some older injury that you've been compensating for. And the brain does this by hiking that pelvis up. All right. So aside from understanding and fixing that older injury, that's the first thing I would say, the most important thing to do to get this to go away permanently is to fix whatever old injuries you have over there. But the easiest way to level the pelvis and the rib cage is simply, let's say it was my left side. I'm going to put my left arm up in the air. And if you take about 10 to 20 steps, you will have leveled your pelvis and rib cage just by doing that, because this whole pattern is coming because of how you're walking typically. And so this is a way to force your body to walk correctly on that side that the side bending problem has occurred on. And then as you get better, you can do the hand above your head less and less as you learn to walk more correctly on that leg. So those would be the 2 easiest ways to start solving the sciatic pain that I usually give for most of my patients.
So I actually have an elevated pelvis on one side we discovered because I was getting some lateral hip pain, but I have not tried that walking thing. I need to try that.
It's a miracle cure. I'm telling you, in 5 or 10 steps, it levels the pelvis and rib cage. Why? Because the pelvis and rib cage are responding to your gait pattern. And ultimately, you're going to have to really more deeply fix that gait pattern and including the injuries in your leg. But your brain is causing all of this to hike up unconsciously because it's trying to get off of that old injury that you think is resolved.
Huh. I've never thought about it that way.
Yeah, it works.
Is there anything else you want to add about sciatica before we switch subjects? Or
Well, along with sciatica, this works really well for SI joint pain too. Because as you can imagine, if we have one side of the thigh muscles that's tighter than the other, then what that's going to do is it's going to pull on one side more than the other, which then creates a rotational force across the pelvis, right? And that creates shear across these SI joints. So this is what I mean by when you start to understand things from a systems point of view, one solution can solve many problems because the manifestation, whether you have back pain, sciatic pain, SI joint pain, it could be all caused by the same pattern of problems in 3 different people. The pattern just manifests as back pain or sciatic pain or SI joint pain based on their genetics, their work history, their exercise history, old injuries, and things like that. But it's all usually the same pattern of dysfunction that's occurring in all of these types of diagnoses.
Huh. Yeah, I've been working on this problem, but maybe I need to try your methods.
I could definitely help you. No problem. It'll be much easier and faster than you think, Mike.
Okay.
So, and this is I guess this would be another thing is a lot of people like you have been wrestling with these chronic problems for a long time because they've been approaching it from a component thinking standpoint. Hip pain means there's a problem in the hip. Sciatic pain means that there's a problem in the back. SI joint pain means there's a problem in the SI joint. This is why it's taking so long for you to try and solve these things, is because you're looking at just too small of an area. Once you understand how all of this whole system fits together from foot to rib cage, you can solve pain so much more quickly and completely and from a longer term perspective because you're fixing the system that's causing all of these vulnerabilities. It's much faster and easier than you think.
So if people wanted to find this specific stuff in one of your books, which book should they get?
Well, all this information is located in my back and sciatic pain book. However, those were written about 10 or 12 years ago. And since then, I've owned my own clinic for about 10 years. And I've really learned to hone, because in my back and sciatic pain book, I have about 80 exercises in there. It's way too much. I'm trying to solve every little thing in everybody's body, right? But what I've learned from my clinic is that, no, we can make this really simple. And I've honed down the exercises to solve these kinds of problems into just a few simple things to do. And so that's what my home programs are. You can find those at rickolderman.com.
Perfect. Any last words on sciatica pain or anything?
No, I would only say that if you've been wrestling with sciatica for a long time, it only means that you haven't had the right information yet. I can almost guarantee that you can beat this thing. I mean, sciatica is one of the easiest things to correct in my clinic. Back pain, SI joint pain, all of these things, because we understand the way these things work. And we're not trained to look at this way as practitioners. And this is why you're struggling.
All right. Well, thank you for joining us.
Thank you, Mike. I really appreciate it.